Hello, Terry Lynch here, medical doctor, accredited psychotherapist, best-selling mental health author, creator of mental health courses for mental health professionals and for the general public. I'd like to briefly talk to you about a course that I'm creating primarily for therapists, psychologists, psychotherapists, counsellors. The title of the course is Working Therapeutically with Clients with a Psychiatric Diagnosis. I'm creating this course to coincide with an article I have written for the British Association of Counselling and Psychotherapy, BACP, their Healthcare Counselling and Psychotherapy Journal. My article will be published in the July 2025 edition of this journal. Generally speaking, people who receive a psychiatric diagnosis tend to be treated far more within a medical perspective than a psychotherapeutic perspective. Having worked now for 25 years as a psychotherapist, a high proportion of my clientele being people who have been given a psychiatric diagnosis, it's become very clear to me that a psychotherapeutic approach, psychotherapeutic work with people who have received a psychiatric diagnosis is far more relevant, can be far more productive than is generally considered to be the case. And this is why I've created this course. There are 4 sections to the course. Firstly, I set out the current mental health paradigm as it applies to the psychiatric diagnosis. In the second section, I critique this current mental health paradigm as it applies to the psychiatric diagnosis. In the third section of the course, I set out a trauma and psychologically informed understanding of the psychiatric diagnosis. And then in the fourth section, I address working therapeutically with clients with a psychiatric diagnosis. It is my considered opinion that the large numbers of people who receive psychiatric diagnoses, generally speaking, get a raw deal, because they are primarily treated within a biologically focused model that really is not fit for purpose. And that's why I've set out the course the way I have. I feel that it's important for therapists to understand, to know the current paradigm, to be presented with a detailed critique of that paradigm, to have a trauma-informed and psychologically informed understanding set out and described, and then the important issue of working with these clients. When we consider the psychiatric diagnosis in some detail, as I do within this course, we arrive at a position, a truthful position, within which it is clear that the medicalization of these experiences and behaviors has been exaggerated to a great degree, and the potential of therapy and a psychotherapeutic approach, a trauma-informed approach, has been grossly underestimated. So if you are a mental health professional, for example, a psychotherapist, a psychologist, a counsellor, and you would like to increase your understanding of the psychiatric diagnosis and be in a better position, a more informed position to work with clients who have been given a psychiatric diagnosis, then this course is for you. I expect this course to become available later in 2025. I'm working on it every day. If you'd like me to inform you about when this course becomes available, message me, write a note or a comment below, and I will make sure that you are informed when the course becomes available. The course will be primarily in pre-recorded video format, so you can access the course anytime that suits you. CPD points will apply, and there will be a space for course participants to discuss and explore ideas, fears, issues in a group with me. Thanks for watching. Have a great day.